Welcome back to another edition of the Hart2Heart Podcast. And my guest today is Brian Lilley, a columnist for the Toronto Sun. So Brian, welcome to the show.
Thanks for having me.
So I'm super excited to chat with you today. I've been following you on Twitter there for a while. You've been putting out a lot of really good content recently that I think a lot of Canadians are very interested in. And certainly I think, the content that you're putting out is very welcoming to a lot of Canadians too, because, we need more people. Not necessarily, I don't even want to use the term like pushing back. I just want to use the term like representing some of the other side that isn't always represented in the media. And so, I do appreciate you doing that. But, just before we kind of get into things, maybe you can give the audience just a little bit of a brief background about yourself.
Oh, okay. I've been at this now, journalism since about, it was September 2000. I started. It was a radio station in Montreal. Worked in Montreal. I worked in Ottawa for years, covering Parliament Hill for News Talk 1010 in Toronto and CJAD in Montreal. Worked at CFRA in Ottawa. Helped launch the Sun News Network several years ago, and rejoined the Toronto Sun as a columnist in 2018. But when I started in the media industry, you just did one thing. You were a writer, or you were a broadcaster, you were on TV, you were on radio. Now I'm on all. So our video channel, the Toronto Sun's YouTube page, has just exploded. I'm pretty much a broadcaster on X now. I mean, it's just either posting clips from, here at Queen's Park. I'm sitting in the studio with the Sun at Queen's Park right now. Either that or something from Parliament Hill, something people have done, or, broadcasting my own rants. So, it's come a long way for a boy from a blue collar background in Hamilton, Ontario. Doing not too bad.
Yeah, well, we certainly appreciate what you're doing. And I think, a lot of other people do as well. So, one thing that you've been covering recently, I think, a lot of people have found this to be a little bit disturbing and maybe even somewhat ridiculous was, recently Justin Trudeau came out and said that he thinks that, essentially climate change is more important than paying people's bills. This is something that I think that you retweeted, something that you commented on. And so when you saw that, like, what was your original reaction, and what was some of the other reactions of the journalists that you're in contact with?
Well, I haven't talked to many other journalists about it, or any other journalists about it, but it just showed how out of touch he really is. The number one issue facing people, and he talks about this, it's not like he doesn't know. But a comment like that's kind of the mask slipping. He regularly will talk about the anxiety that people have and paying their bills and the cost of living, which, look, I don't think he really understands it because he's never had to worry about it. You compare him to someone else who's born into a wealthy family, though, and but understands it, would be someone like Doug Ford. They both of their families have money, but Ford actually goes around and drives his own car, pays his own gas. He goes to the grocery store once in a while. I know this because he talks about it. So he sees what things cost, and he sees the prices go up, and he's also run a business. Trudeau has never run a business. And so his family's had money since his grandfather made a fortune with gas stations. A lot of people don't know that. That's where the Trudeau family fortune comes from. He made a fortune.
I don't know this, actually.
I believe his grandfather's name was Charles. He died young, I think early 40s.
Oh, wow.
But he made a fortune in the private sector. He ran a chain of gas stations and a loyalty club that some have compared to like the Canadian Tire Money thing or an early version of CAA. So he made a lot of money off the sector that his son now vilifies. And so they haven't really had to work for a couple of generations. And so I think Trudeau's out of touch on that. Politics is interesting. You get to see what people are truly fascinated about. And one thing that I've learned from years of talking to pollsters and watching what people say is the most important issue to them is that climate change becomes the number one issue when everything else is going really well. I honestly don't think it is the number one issue for very many people. I mean, for activists, yes. But when the economy's doing well, when you're not worried about putting food on the table, when you're not worried about losing your job, getting access to healthcare, then when polling firms come around and say, oh, rank these issues, you go, oh, climate change. Oh yeah, that's really important. Why? Because everything else is going great. And then as soon as the economy starts to go sour, climate change falls down the list, but not for Justin Trudeau, which is why he says it's more important that you pay more for goods to help the climate, even if you can't afford it.
Yeah, I don't think there's very many people who are in agreement with that statement right now. And I do agree with you, the fact that, I didn't know about all of his background. So thanks so much for telling us about that. But, when someone is that out of touch, when they've never had to, they never had to work before, like I'm sure obviously he has, had jobs and has worked, but he's never really had to for the money in any regard. And he does seem to be out of touch. Like you said, like he's not, going to the gas station, and getting his own gas. He's not going to the grocery store, getting his own groceries, these kinds of things. So, that does put him, I think, out of touch. And I think that people, recognize that. And, from recognizing that, they're probably going to, not support his position. And, with regards to what we're talking about with the economy, this is something that affects everyone, and for some people, though, it affects them much, much more than others, and
oh yeah.
Trudeau
Like if you're on the margins, having a rough go, the food inflation over the last couple of years alone, no wonder so many people say they're cutting back. Inflation report was just out yesterday. It's gone back up to 2%. That's within what the Bank of Canada calls the acceptable range. But guess what? Once again, food inflation is even higher. So we're paying about 25% more for groceries than we did 3 years ago. So whatever you paid $100 for 3 years ago, your $100 basket of groceries now costs $125, and it's going up 2.7% more. That hurts.
Yeah, that hurts big time. And bringing back to the inflation rate as well. So, you talked about comparing the food inflation rate to the normal inflation rate, the overall inflation rate. But it's also too, like, housing has gone up, I think, also disproportionately to the overall inflation rate. So the overall inflation maybe doesn't look too bad. But when you're looking at, essentials, the things that people need, like food and housing, those are the things that are going up more. And so people are deeply affected by this.
I was in Arizona at the beginning to mid-October. About 3 weeks before the election, I got to go tour Route 66, which was fantastic. But I spent a lot of time observing politics in Arizona. It had been strongly Republican for a long time, and they voted for Donald Trump in 2016. 2020, people aren't happy with how the pandemic's going. They voted for Biden. The state is turning more Democrat as the years go on, and there's demographic changes, people moving in. And it was looking like a real toss-up. And then what ended up flipping it was the cost of living and inflation. In the county that holds Phoenix, Scottsdale, Mesa, this was a staggering stat that I found while I was down there. House prices went up 47% in 4 years. This had been a place that was relatively affordable for major American cities. Phoenix area's sixth largest metropolitan area, I believe. So pretty major area. But the house prices have been fairly affordable. They went up 47%. And then, they're also dealing with the food inflation that we are, although not to as big a degree. So Trudeau saying what he did about climate change, pay attention to what just happened south of the border, buddy. Donald Trump was voted in large part due to the economy. Immigration was an issue. There were other issues, but the economy because people don't feel like they can get ahead now. People feel like life is too expensive. And we're dealing with the same thing here in Canada. Yes, the inflation rate overall has gone down. That doesn't mean prices fell. It was didn't we get as high as 8%, close to that at one point? Now it's down at 2%. It's, prices are still going up and we're still absorbing that shock of, so many years of high inflation. So, any politician that isn't in tune with that is going to feel the brunt of it from voters.
Yeah. And I think too that, traditionally, and again, I'm not saying this is a correct statement, but traditionally, people have thought that conservatives would be better for people who are wealthier and, not as good for people who are in low income brackets, and that, liberals would be better for people in low income brackets and maybe not as good for people who are wealthy. But I think that right now we're not seeing that at all. I think that the liberals are basically, hindering everyone in Canada at this point. I think that there's a lot of people in high income brackets who are very upset with Trudeau, especially some of the taxes that he imposed last year on capital gains and things like that. And now people in lower income brackets who essentially are living month to month just to pay their essentials are seeing their essentials going up. And so because their essentials are going up, I think those people are upset as well. So it seems like at this point, he doesn't really have a plan to really please anybody economically.
No. And, they've been bragging about their attempts to ease poverty rates and such and bring kids out of poverty. A report just came out yesterday, childhood poverty rose again. They have been involved in a lot of income redistribution schemes, no doubt, especially, that's part of why they're hiking taxes on the wealthy. They always say, they have to pay their fair share. At what point does taking 50% of somebody's income, how is that not their fair share? It's a twisted mindset that says, I should be able to take 50% of what you earn, Michael. Like you should just give me 50%. You sit down with a bunch of kids and pass out candy and then start acting in that same way and say, no, you've got to give it all to them. Watch their natural reaction. They'll scream, they'll freak out. That's not fair. But that's how we do it in the tax world. And so he's had all these redistribution schemes, and even the carbon tax, they have come out and said it's an income redistribution scheme. And the only people that are benefiting are people in the bottom 2 quintiles, so the bottom 20%, the 0 to 20% quintile and the 20 to 40%. They're getting more money back. And the rest of us, when you look at the parliamentary budget officers, full breakdown, when you include the GST, when you include lost opportunity, shrinking economy due to the carbon tax, we're all paying a lot more to the government than we're ever going to get back in those fake rebates. So he's attempted to do a lot of income redistribution, but most people still feeling the pinch, and childhood poverty, as I said, on the rise. And so, the Liberals are dismissing Pierre Poilievre as, well, he's just sloganeering with axe the tax. You know what? Axe the tax sounds real good right about now. Carbon tax is scheduled to go up again on April 1st. So is the tax on beer and wine. So, if you decide you're going to have a drink to drown your sorrows a little bit, that's going to be more expensive as well. Yeah. There's nothing they won't tax. And, government spending's gone up by 40, 50%. Are your services better? No.
Yeah. I mean, I work, obviously I'm a physician, and, I work as a family doc in very, very busy walk-in clinics. And I can tell you that, people are desperate for a family doctor in London, Ontario, but I think that's most of Ontario and really across Canada. And so, that's another, point too, like we were discussing earlier, that people were saying that liberals classically are, better economically for certain people, and classically they're better for healthcare, which is just not the case at all. because healthcare over the last, 4 to 5 years, obviously the pandemic has been, a big part of that, but healthcare in Canada has really, gone down and decreased dramatically in terms of access to primary care physicians and also to ER wait times.
So, I mean, funding for healthcare is primarily provincial, but the feds do put into it. It's funny. Trudeau denounced Stephen Harper's plan to only increase federal healthcare transfers by 3% a year as a cut to healthcare. It wasn't a cut. It's still a 3% increase. But then when he got into power, he implemented Harper's plan. So if you remember back then, people were calling it a cut. And because it had been about 6% a year increase from the federal government, it's a very large increase. And then Harper said, okay, starting in 2016 or 17, we're only going to increase it by 3%. We've got to get spending under control. Trudeau denounced it as a cut. He's kept that in place his entire time in office. Provincially, I ran the numbers a little while ago. The Ford government has increased health spending by 34% since they took office, which is staggering until you do this. You have to account for inflation, which we just talked about. It's been up. Well, inflation was up for what it costs to run a hospital, what it costs to rent out space for your doctor's office, your family clinic. Wages had to go up. So once you account for inflation and population growth, they've only actually increased spending by just a little bit, like 2 to 3 points. So they haven't cut it. I know the opposition will always claim that conservatives cut healthcare even when they increase spending. But the population growth that we've seen across Canada, but especially in Ontario, we've talked a lot in this country about how the population growth has affected the cost of housing, contributed to the housing crisis. Well, you can't add 1.2 million people per year without also putting strain on the healthcare system, because the people we're bringing in are not doctors. They're not nurses. So, this is part of the problem with primary care. If the Ford government had increased healthcare spending by 34% since 2018, but we hadn't added 2.5-3 million people to Ontario's population since then, I don't think there'd be any problems with health spending. Of course, we wouldn't have the money to increase it by that much, but we're still feeling the pain on health. I would argue in part due to the out of control population growth driven by immigration numbers being ratcheted up to a point where even Justin Trudeau said we're bringing in people faster than we can absorb them. And that's the problem. It's not that immigration is bad. It's that you take 1.2 million people a year and you're not adding the housing, you're not adding the doctors, you're not adding the schools. The impact on schools from this massive population growth has been massive as well.
Yeah, well, I can tell you from like a healthcare perspective, it's incredibly difficult. And again, I'm just speaking truthfully here, but like when I see patients in my walk-in clinic, there's definitely days where over 50% of my patients are not speaking English as their first language. And this brings up another point too, because if someone doesn't speak the same language as me, then the appointment's going to be longer. And so that's going to increase wait times. And so if you have someone who speaks the same language as you, you can complete the appointment a lot quicker. And, this is something that I've chatted about a little bit before. And, I don't think it's controversial. If we were talking about, say, buying a house or, ordering dinner and the server, spoke a different language than you, I think everyone would agree that, okay, maybe it's a little bit more challenging at times. And we really got to make sure that we don't get our order wrong because there's communication. And that happens in medicine. So it makes it more difficult and it makes the appointment longer.
How much more difficult is it for you to be able to treat them or understand what the problem is? When I lived in Quebec, not very good at French. Trying to speak to French doctors who, depending on where you were in the province, the further you get away from Montreal, the harder it is to find people who speak English. That becomes an issue. How do you explain what's wrong with you to someone who's not speaking your same language? So, I mean, how is that? Like, how do you get around that?
It's dangerous. I mean, sometimes I say to people, listen, like, we don't speak the same language. I think this is too dangerous of an encounter for us to really like proceed here. And so, luckily we do have one guy in the office who does speak Arabic. And so, sometimes for those patients, I can, just refer them to him. But it's very, very challenging. And like, I don't think using Google Translate and these kinds of things are very safe, so, the technology is just not there yet. And it's really, really slowing things down in the clinic. And like, you wouldn't believe the lines that are in the walk-in clinics that I go to. Like yesterday when I showed up before 9 o'clock, there was literally 10, and this happens all the time. There's 10 to 12 people outside standing in the cold rain, just waiting to be seen. And then the clinic just fills up. Like I've had times where, I go in for 2 o'clock and then at 2:30, I have to tell, the staff to close the door, to close the doors because there's already 40 people there. And I'm like, I can't see more than 40 people in the next, 4 hours. And so, and that's just one clinic in London, Ontario. So we know that this is going on, across Canada. And yeah, I think that, people deserve, healthcare, but I also too, and this is an important point, like, people say like it's a right, like it's an absolute privilege is what it is. It's an absolute privilege to be able to go to a healthcare provider for free and have them treat you. And, we don't really look at it like that way. And so, in terms of like what's going to happen in the future, I mean, people are sounding the alarms, but, to be honest, I don't know what's going to happen. I really, really do fear for people not having access to a family doctor and not having access to proper, ER health times as well. Those are the two. And we haven't even talked about specialist wait times, but, just primary care is atrocious in Canada and Ontario.
When I talk to my American friends and they ask about our healthcare system, you get two reactions in the States. Either, oh, that's horrible, the idea of a government healthcare system, or they admire it. And if they admire it, then they have false impressions that everything's hunky-dory. But I always say, look, the care is great when you get in. It's getting in. That's the problem. I think the Ford government has been making some smart moves. You mentioned earlier about how people have preconceptions of, well, this party's good for this party's good for that. Nobody ever thinks that, conservatives, they're bad for healthcare. I mentioned the 34% increase in health spending. When the McGuinty and Wynne governments were in, I ran these numbers years ago. I was looking at the increases that the government had done in education spending. The Liberals during the McGuinty and Wynne years put all the increases into education, and they kept hell, including contracts with doctors and nurses, pretty much at a flat line. It was the minimum increase they could get away with each year when compared to health. I'm not saying they didn't increase spending. Every government increases spending. We're, large population growth, even before we got into the craziness, is always population growth going on. So you have to increase spending. But yeah, the Liberals kept it pretty much on a flat line. The Ford government's increased spending dramatically. I think they are making good moves on, opening up these clinics like the cataracts, hip and knee, these operations being done in private clinics, but then paid for by OHIP. I think that's good. It's been going on for almost 2 years on cataracts now. And thousands of people have had faster access to surgery. It's about to take off with hip and knee and then MRI and CAT scans. So, those are good moves, but that doesn't give you access to primary care. And I don't know what the answer is on that. They have announced two new medical schools, York and Toronto Metropolitan. Hadn't had a med school come online in years. We hadn't increased the number of seats to train doctors in years. I mean, that's craziness.
And you know what else is craziness? We train these people and then they go to different countries. They don't even stay here.
And so that's, I'm not sure if it's starting this coming year or the year after. That was one of the announcements that Ford just made. No, you got to stop this. You've got to stop, giving seats in medical schools to doctors from other countries. I was hearing from
you make them commit for 5 years or 10 years to staying here,
and that would be one thing. But my discussions with people in the medical schools is most were leaving. They would come to Canada to get training because it's considered excellent training. You go to Queen's or U of T medical school. Well, then that's as good as going to Harvard Medical School in whichever country they're coming from. It was considered fantastic. That's great, but now we've just trained at a subsidy to Ontario and Canadian taxpayers doctors that are going to go practice in Dubai, let's say.
And that's a perfect example. I just want to interrupt you there just because recently, it's just so ironic you said that, but I had a guy who worked with me recently. He was a gynecologist, and trust me, lots of people need gynecologists, and the infertility stuff going on is just wild. But we could have really used this guy's services. And, I asked him, are you staying in Canada? You going back? He's like, oh, I'm going straight back to Saudi Arabia. It's like the money there is way, way better. Quality of life is way, way better. Like there's no way I'm going to stay in Canada.
And we had a program set up specifically to train doctors from Saudi Arabia, which is fine, but not if they're taking seats away from Canadian kids. So they just recently announced that you've got to, reserve seats for Ontario students first, Canadian students second, and then international if there's space. The York University Medical School is going to try and focus on training GPs. Now, you can't tell someone, no, you've got to stay a GP for life. If they want to go off and become a specialist, they can. We're not going to live in that type of society. But their hope is that with their recruitment efforts and their emphasis on practicing family medicine, that they will attract people who want to go into that, because there's no school in Ontario that focuses on that. And so, I think these are good efforts, but they're very long-term. Short-term and medium-term, I have no idea what we do to solve the lack of access to primary care. And that's not an Ontario or a Canadian specific problem. You look in the United States, they're actively recruiting from around the world. The World Health Organization says there is a global shortage of health human resources, HHR, shortage of doctors, shortage of nurses everywhere. So we've got to train more people, but that takes a bit of time.
Yeah, it does take time. And then also too, one contributing factor is, the younger generation, doesn't work like the older generation. We know that. And, like you said too, like if someone wants to become a specialist, they don't want to be a family doctor, like that's their right. You should be able to, do what you want. But the fact is, like, the average family doctor, the last time I looked it up, sees between 75 to 100 patients a week. Me and a couple other guys, at the clinics that I work, we see 250, 300 people a week all the time.
Wow.
But, we're sort of, sorry about that. But, we're sort of, a little bit different than, some of the other guys that are coming up now. And so because of that, we do have a little bit, fewer people overall now who are, working, or so we have more people overall now who are working less than others, So I think that's a little bit of a distraction as well, or an issue.
Yeah. Well, and as more doctors there's an increasing, and has been for many years, increasing number of doctors who are women. Statistically, women work fewer hours than men, especially once they start families. That's not a criticism. That's just a reality that we have to then adjust. And my understanding is it's the same in medicine, seeing fewer patients. Men just, I don't know, we're dumb. We work longer hours. You can find all this data in StatsCan, but as we're making this adjustment, we've got to say, okay, well, if we've got 50% of new GPs are women, and they're going to see 20% fewer patients than the male ones, then we have to increase the number of doctors. But again, where do you find them? Where do you get them? As I said, adding in the new TMU school, adding in New York is good, but I understand it takes longer than a year or two to become a doctor. I've never done this, but
it's
7 or 8
4 years
years
undergrad, 4 years medical school, and then 2 years residency for family medicine. It's 5 years to become a specialist. So it's at least 10 to 13 years, depending on what you want to do. And then the family medicine residency in the States is actually 3 years, not 2 years in Canada. So we're kind of lucky on that one, but they have to do 11 years, so it's quite different. One thing that I want to chat with you about today, and this is too kind of stays on the same point of healthcare a little bit, or quite a bit, is, closing of the safe injection sites. So, I fully support that. I've had, other physicians on the show before where, we've talked about, how, like Dr. Sharon Koivu, for example, and we discussed, how dangerous, some of these, safe injection sites are. And then the whole safe supply program is just, it's absolutely bonkers when you actually, realize the numbers that people are pouring out, like 30 to 40 dilaudid number 8s like a day. Like one dilaudid number 8 is equal to 5 Percocets. So that means that if someone's getting 40 dilaudid number 8s a day, which they do, some people do, they're getting 200 Percocets per day. 200 per day. That's insane.
And they want to claim that people aren't just selling them and diverting them. What was that big bust in London? 30,000 pills in one bust?
Yeah, exactly. And those are just the ones that they found. Imagine all the ones that they haven't found.
Yeah. So I've interviewed Dr. Koivu as well. Had her on my Full Comment podcast a little while ago. And if I recall, she was originally on board with harm reduction, and still says harm reduction is good if it's part of a full program. She's the one that first said to me, there's 4 pillars of drug policy, and we've forgotten every single one of them except harm reduction. There's no more enforcement. There's no more prevention. There's no treatment. That's how we got sold.
Very good point. Can you say that again? Sorry, what she said?
Oh, so she said there's 4 pillars to drug policy. It's prevention, enforcement, harm reduction, and treatment. And she said that we've forgotten all of them except harm reduction. And I think that's accurate. We were sold on safe injection sites. There wasn't really a discussion around safe supply. That just was kind of thrust upon us by the federal government quietly, it seemed. But, safe injection, there were debates about it for years, and court challenges, and I think a lot of the studies around it were faulty. I think they were manipulated. I think they outright lied in some of them.
And we know that too from scientific research that happens a lot. I mean, we won't get into it here too much, but like the Vioxx scandal, there's so many different things. So what you just said has happened before so many times in medicine.
And I haven't looked at it in a long time, but I remember a decade or so ago looking into, the claims being made around places like Insight. And what I found and documented was, the peer review process. Okay, Mike, you're writing a paper, I'll review yours, you review mine, and then we'll call over our other buddy here and they're going to review. And so, they were all people with the same philosophy, the same mindset, the same activism. And that's really what they've become. You've got another doctor in London, I forget her name, but she's a real activist on this front.
Dr. Sereda, let's just
yes,
say
that's
name.
it. Yeah. So they, but when they were selling us on this idea of injection sites, it was, this is a way to get people to treatment. That never happened, because the activists don't actually believe in treatment. They believe, and Zoe Dodd, who's one of the biggest activists in the country on this, lives here in Toronto. She said straight up, that she uses, and this is a lifestyle, and she believes that should be fine. Why I have to subsidize somebody's drug lifestyle is beyond me. We were sold it as a way to get people to treatment, and then you look at space after space where these were put in, and offering someone treatment was considered judgmental. And a lot of people don't believe me when I say that. One of my colleagues told me that years ago, and I thought she was crazy. An experienced veteran journalist said, well, I was interviewing the public health people and they told me that. I said, that can't be right. She showed me. You look at the South Riverdale Community Health Center here in Toronto, where the shooting happened a year or two ago. That place had right on their website that they had no desire or expectation for you to stop using drugs. They were there to supply you with a safe space. And what most people don't know is it had become a safe supply, quote unquote, space as well, because it was the way safe supply came in, the provinces didn't have to agree to it. Now, the bureaucrats off in the background would, and they would work with the federal government on this sort of thing because they bought into this idea. It's religion to them. But the feds gave exemptions for these places to hand out the pills and prescribe them, and they funded it directly. So the Ontario government has never had a safe supply program. Apparently, they inadvertently paid for some of this, but it was all pushed in by the federal government. As you've documented, it's an utter mistake. 40 dillies a day.
That's equivalent to 200 Percocets. It's actually even more, because I think one Percocet, one Dilaudid is even slightly more than 5, like 5 point something. So, and Dr. Sharon Koivu, shout out to her again. She's, just a wonderful doctor here in London, really, really well balanced, really well spoken. She's one who explained that to me. And so, we have this, and that's too, like the issue with like the so-called left sort of thing is like, they don't have any boundaries. It's like, how many drugs should we be supplying to these people? As much as they want. Like, that's essentially like the answer, and so we need to put an end to this.
When you look at issues like the diversion of these pills, so they're given out to help addicts, we're told, but then the addicts turn around and sell them. That's in fact why the shooting happened at the South Riverdale Community Health Center, is because it had become a place where people would go get their dillies. Well, dillies don't give you a high that's as good as fentanyl. So the dealers were actually hanging out in the park right next to this space. And the shooting happened because the dealers were fighting over turf, over who would get to sell, who would get the dillies that they would then turn around and sell on the street to kids. That was what the fight was over. They're shooting at each other, and an innocent woman walking down the street to go buy lunch gets killed. I mean, this was not done in a dodgy part of town in the middle of the night. It was lunch, and that happened. So we know the diversion's going on. I remember when Pierre Poilievre first asked about this in the House of Commons, Carolyn Bennett was still the minister in charge, a physician, no less, although I'd be afraid to let her treat me for a broken toe. I'll tell you that much after covering her for years. They denied that there was any diversion going on. They said that was a lie. And then Global came out with their their video. They went on the streets of Vancouver, and it took them minutes to be able to buy dillies, $1 a pill. And Adam Zivo at National Post, Adam has done great work on this, and they just deny. And then they say, but it's not a problem. And then they admit, okay, it's happening, but not as much as you think. The amount of pills being seized, London, the pills that are diverted out of London are now being sold in remote northern communities from Thunder Bay to small towns. So the clinics in your hometown are spreading deadly drugs to kids all across northern Ontario.
Yeah, I mean, the Safe Supply program started in London, Ontario. We were the first place to have this program. And
2016.
Yeah. And we know, I have several, police officers who are friends, and, the police have been much more vocal about this over the last few years. But, they say, they see it on the street, and people are ODing. We know that, opioid increases, opioid deaths and opioid overdoses have, skyrocketed, since the program began. And so, and then you couple in too, we're talking about, poor economy earlier. I mean, when there's poor economy, people are more desperate, they're more in despair, they're more likely to use these kinds of drugs. So, you have this crippling economy, a lot of, people in the lowest income bracket. And then all of a sudden, the streets are flooded with drugs. And I should say too, I don't know exactly the cost of, the drug per pill for a D8 or for, a Percocet on the street. But I believe Dr. Sharon Koivu knows numbers on that. And I don't want to, misquote this, but I think they've gone down something from $10 or $20 a pill to $2 a pill. You can buy these things for so cheap. If you, if
I've heard as low as $1 a pill.
Yeah, $1 a pill, right? And so when you're a teenager, if I want to, get some beer when I was younger, to get that money was, tricky, to be able to, go out with, again, I'm not, advocating for underage drinking or things like that. But, when I was younger, with my friends,
many of us may have done that.
Yeah. I mean, to get the cost of, 3 beer, 6 beer was, substantial for me at that time. But, to be able to get $1, I mean, to get a high, I mean, that would have been a joke. So I think that, we're also putting, kids at risk and people who, don't have as much money at risk, who are looking for a high, and now they can get it so much easier because it's so cheaper and so much more accessible. There was no opioids when I was in high school, and, I'm an 84, so I'm 40 years old. So, I am going back a little bit there now, but, it just wasn't available. But now these drugs are available everywhere. So, I just wonder, if things would have been different, if these drugs were available when I was younger.
Well, I mean, we're seeing the stories of kids getting high, kids getting addicted. The heartbreaking story of that girl who died in a homeless encampment. Her parents could not force her into treatment. They couldn't force her to do anything. And so, thankfully there's a bit of a change. I mean, even the NDP government in British Columbia, mainly, I think, to try and save their political skin, they've adjusted their view on this. And Premier David Eby has said, you know what, maybe we should be looking at involuntary treatment, particularly for youth. That's how much people are noticing the harms that these programs have caused, that we're now talking about involuntary treatment. The Alberta government is looking at doing that. The BC government, Ontario will consider it. I don't think we've gotten there yet.
And I'm not against that. Some people, are against that. And certainly, I, have a big libertarian point of view, and I think people should be able to do what they want. But at the same time, I can form one someone. So, I've only done it, I think twice in my, 12 years of practicing medicine, where if someone is, I think a dangerous to the community or dangerous to themselves, I can do this form one, and then police have to come pick them up at the office and bring them away. And, obviously if I think that someone's going to harm someone else or harm themselves, that's when I'm going to do it. And those were the instances, in those particular two cases. So, for someone like this, and we're talking about, Sharon Koivu's thing about prevention. I mean, this is preventing someone from potentially killing themselves, potentially from someone, getting addicted to drugs, potentially someone from and when someone's addicted to drugs, like that affects their whole family. Like if you're a family of 4 and everyone's doing well, but you have, one sort of, problem child, so to speak, who's, bringing in drugs all the time and kind of disrupting the family function. Like, again, it doesn't just affect one individual, it affects all the people around them. And so we need to do, a better job of recognizing that. And I think that, putting some of these people into involuntary treatments is the appropriate move.
Well, I know it's not the compassionate thing to, the people that if I walk 2 blocks from where I'm sitting in downtown Toronto and, went over to Yonge Street, I will see people who are clearly suffering due to their addiction. They are harming themselves. They are harming the community with their actions and violent outbursts as well. So yeah, they're I'm like you, a strong civil liberties bent in me, but just saying, oh, well, there's nothing we can do about it doesn't seem right, especially now with the explosion of it, with so many people in this predicament. So look, they just introduced the legislation yesterday or the day before to get rid of the safe injection sites next to schools and daycares. The only people, in my view, that are arguing that this is the wrong move are insane. They're freaking radicals. If you're going to tell me that, no, it's good to have a safe injection site next to a school, then you're doing it based on your own ideology or, oppositional defiance disorder towards the Ford government.
Yeah, I agree with you. And what's even more insane about that is the same people who are for all this are like up in arms against like beers and now going in, the gas stations and grocery stores. Like it's crazy. I mean, I grew up in Newfoundland. Okay. So we could get beer at gas stations my whole life. Okay. And, it doesn't cause that big of an issue. I can tell you that. And you lived in Quebec. I'm pretty sure the laws there, you can get, beer at gas station store. And then people are comparing, getting, alcohol at gas stations, comparing that to safe injection sites. Like that there is absolutely insane. So you think that it's okay for someone to have a safe injection site near a school or near a daycare, but you're against someone having to go to, say, the beer store instead of a convenience store to get beer. Like that is quite literally insane. Like I don't know how anyone can come up with that point of view, but there's people online, there's doctors, there's politicians who are like screaming about this.
I live right near a pile of places that now sell beer that didn't before. You know what? I'm still seeing the same level of people smoking crack pipes on the street corner or in the parks, but I'm not seeing any drunken disorderly. And I live near U of T, for goodness sakes. U of T is just down the street from where I'm sitting now at the office. A ton of students, not seeing drunken disorderly students. I'm not seeing the regular homeless addicts that I see all the time sitting there with a beer. No, because the pills are cheaper. A beer at 7-Eleven costs you $1.99. I'm sure they're getting the dillies cheaper, or they're getting stuff handed to them. And crack is cheaper. So that's an insane comparison. But finally, someone is moving to, build these, what are they calling them, heart hubs, with wraparound supports, with treatment. Some people will be able to live there. Others will be able to come in and try and get their life straight while getting addictions counseling. I don't see how that can be considered a bad thing, injection sites a good thing.
Yeah, I totally agree with you. I know we only got 10 or 15 minutes left, and one thing that I wanted to chat about you today was the election results that happened last week, or I guess it's 2 weeks ago now.
2 weeks,
yeah, 2 weeks almost to the day. So what do you think this does for Canada with Trump winning his election? What are your thoughts?
Well, my view from a Canadian vantage point all through the election was neither Biden nor Trump were good for Canada because they're both protectionist. And then it became neither Harris nor Trump are good for Canada because they're both protectionist. Democrats are more protectionist than Republicans. They do it in different ways. Everyone talks about Trump and his tariffs.
When you say protectionist, what do you mean by that?
They try and shut down trade between Canada and the U.S. So there's a rail car factory up in Thunder Bay that produces streetcars and LRT cars and commuting train cars. And they used to sell a lot of products into the U.S. Well, successive governments, administrations down in the States have increased the Buy America provision. So even though we technically have a free trade deal, it's a managed trade deal. So we don't have full access to the American market. So the rail cars that they build up there, they still build some of them, but then they have to send them down to the States for all the interior work to get done. So they can assemble the car up there, but they can't, install the seats. That work has to be done in the US. Things like that. And that's one that actually both Biden and Obama and Trump all increased the amount on for their Buy America provision. So, or Trump's talking about tariffs. The difference between how Trump handles trade and the protectionism versus Biden, though, is everyone knows about Trump's because he's loud about it. He's loud and he's brash and he tells you up front, hey, I'm coming at you. And there's normally something he wants in exchange. Like you can normally cut a deal with him to avoid these things if you do what he wants. But Biden and Obama before that, they're all smiley and Canada's our friend and we would never do anything. And then they're slipping a knife in between your ribs. The Inflation Reduction Act that Biden brought in, there was a whole section, and the proponent of that section, by the way, was Kamala Harris. But the original section on subsidies for electric vehicles in that bill would have decimated the Canadian auto industry. And that was not by accident. These were requests from the United Auto Workers. This was the second attempt that Biden had made to try and take all the Canadian auto jobs and transfer them down to the US. The first one was during the bailout in 2008, 2009. That move forced the hand of Dalton McGuinty and Stephen Harper to join in the bailout, because if they didn't, the requirement was going to be that all the jobs move south. So the Inflation Reduction Act, to get the EV subsidies, you were going to have to have the vehicle built in the U.S., assembled in the U.S., an American-made battery. Basically, it was everything has to be made in America, and if not, you don't get the subsidy. Well, that would have shifted all the jobs down there. The only reason that was defeated was they also included that it had to be a unionized plant. Well, there's Democrats in West Virginia and Georgia that represent areas that have auto plants that are not unionized. And that's the only reason that whole thing fell apart. They were trying to screw us over. So Trump's going to make demands that we redesign how we trade. I did a long video interview with the former Consul General of Canada for Los Angeles, and he was in some of the meetings with the Trump administration the last time. And his advice was, listen to what they want, because when they're making a move, they normally want something. They're doing it for a reason. So mainly Trump is focused on China. If we act properly, we can be on the right side of the tariff wall. And if we're stupid like we were last time, the Trudeau guys didn't listen and they lectured and they harangued, well then, we're going to put Canadian jobs at risk. So That's just from the economic side. On other things, and I know you and I were saying by email, it's exciting that someone like Dr. Jay Bhattacharya will potentially be in charge of the National Institutes for Health. I think that's a great idea. And I sent you a message saying that. So that's, I like that he's going to shake things up in the States. I'm a little worried on the economic side for Canada, but how we handle that will have a big play on that.
Do you think that there's like no control within the Canadian government into how that plays out? Or do you think that, say, if Pierre Poilievre gets in, now obviously we know it's going to be probably a full year before that happens, unfortunately, but do you think that if he gets in, he could sort of mitigate maybe some of the, economic devastation that may be coming to Canada? Or is it also too that just that, Trudeau's going to be in, it looks like anyway, for almost another year, and that, we're going to have to deal with a lot of the economic backlash from even just within this 1 year of Trudeau being in with Trump. I mean, I guess it won't be a full year because Trump doesn't get in till February, but is that going to affect maybe Pierre's term, and how is Pierre going to maybe, make things better than what Trudeau could do?
I've got a friend who says the Liberals should really want to have an election now and lose, so that they're not dealing with the Trump administration and any economic, downturn that Canada may face. The last time Trump was in, and he put on the tariffs on steel and aluminum, and that put jobs in Hamilton, in Sault Ste. Marie, in Regina, in Edmonton at risk, and in northern Quebec where the aluminum's made. It didn't have to be that way. A year before they put the tariffs in, the Trump administration said to Ottawa, look, China's dumping steel and aluminum into Canada, and then you guys are shipping it down here as if it's Canadian product, which gets it a more favorable treatment at the border. You've got to stop that. We're fine with Canadian steel and Canadian aluminum, but you can't pass off cheap Chinese products as Canadian and get in tariff-free. We want you to address this. They told them that for a year. They wrote to them multiple times. It was raised in meetings, and the Trudeau government did nothing. That's why we ended up getting the tariffs. Their focus again is China, which China subsidizes everything. Like the electric vehicles. There's one that's selling for about $12,000 US. That's half the cost to produce it, but that's what it's selling for. And why is China doing that? To try and get market share and be dominant, not this year, but 50 years from now. So Trump is focused on stopping China from doing things like this. We can either be a partner with the Americans and be on the right side of the tariff wall, or we can be stupid. Last time, we were stupid. You won't find what I said in many media outlets because, and I suspect it'll go this way again, most media outlets in this country spent the 4 years from 2017 to 2020 just yelling orange man bad. And my view is he's the president of the United States. It's reality. We have to deal with him. We're probably going to see that happen again. So that's why you don't see what I just described about the tariffs. You just hear, oh, Trump targeted Canada. Trump declared as a national security threat. They were open. You could see the congressional testimony. You could see the letters that they sent to the Canadian government. And it wasn't the fact that we put tariffs on their products that got the tariffs on steel and aluminum lifted. It's that we finally dealt with the problem that they told us you need to deal with. So whoever is in charge in Ottawa, whether it is Trudeau or Poilievre, they've just got to spend time listening and then acting appropriately. It doesn't mean we have to roll over and do whatever the Americans say, but if they say, look, you're letting in underpriced, subsidized Chinese electric vehicles, and then they're being sold into the United States, stop that. Well, we should stop that, because otherwise the vehicles made in Canada by Canadian workers will be put at risk.
Yeah. And, you mentioned earlier too about, Trudeau not owning, a business or not being like a businessman. I think that that's a lot different with Pierre. I think he understands that, quite a bit more than Trudeau does. He understands economics. I think he understands that, there's some give and take in relationships. And I think that with, Trudeau, maybe he was just willing not to give, not to take anything, and really didn't want to, put in his best effort to make this relationship, amenable for both people. And again, we don't need to roll over, like you just said, but you have to deal with reality. Donald Trump is going to be the president for the next 4 years. And so because of that, you need to establish a strong relationship with him, and you need to make sure that, there's going to be an appropriate give and take. And maybe it's not, perfect all the time, but it's something that it's least, better than rolling over. And it's also, a lot better than, not being compliant at all and then getting screwed over that way.
Yeah. And you can't be the way some of my colleagues in the media are saying, I will not normalize Donald Trump. I don't know what that means. So you're not going to talk about him like he's the president. He is the president. You have to deal with reality, But, to give you another example of, why we should listen, this fellow that I interviewed, and it's in one of my latest columns up at TorontoSun.com. He described being in a meeting with top Trump official, and the issue of softwood lumber tariffs came up, and they said, he said, looking back in hindsight, the Canadian delegation was lecturing them, and they're saying, don't you understand? This is making homes more expensive for Americans. And their response was, so what? So our argument had no, influence on them because they didn't care about that. They were putting the tariffs in for a different reason. And that's why you got to listen and figure out, why are they doing it? Trump is a guy who likes to wheel and deal. So, in any negotiation, it's finding out what the other person wants and how you can deliver that to them while also getting what you want. If that's the attitude we take to this, that'll be great. I have serious doubts about Chrystia Freeland being the person to do this. She gets a lot of credit for renegotiating NAFTA. I don't give her much credit because we didn't get anything new in it. We, in fact, gave up things. And when you looked at what the American goals were, they have to publish their goals. That's a weird thing about America. Any trade negotiation, they have to publish in Congress, here's what we're going to try and achieve. And theirs was all about greater access for their exports and their services. And our goals, the Trudeau government put this out, gendered language. We want to get the language around gender correct in the agreement. That was one of the goals. Okay, I'm worried about the auto plants along the 401 near you still being able to supply plant in Michigan, an assembly plant. They're worried about gendered language.
Yeah, talk about being out of touch with people. I mean, that's clearly not the issue here that people are most worried about, and that's going to affect most people. I mean, that's almost hard to hear. Like it's so silly. I'm still shocked that
I cover politics so people like you don't have to pay attention to the nuttiness.
Well, I appreciate that. That being said, I know our hour is up here, Brian, but is there anything else that you want to share? And lastly, please tell people where they can find you online about the Toronto Sun and anything else that you're doing.
Yeah, so TorontoSun.com, obviously. I'm on X or Twitter, at Brian Lilley. You can find me on Facebook. I've started posting there again as well, mostly video content because I can't link to my articles, but people like seeing the videos and seeing pictures of my dog, Chloe. So,
I like seeing pictures of dogs too. So I'll definitely check it out.
All right.
Thank you so much for coming on today. I really do appreciate it. You've shared a lot of great information. I think a lot of, Canadians maybe not be aware of, and, I appreciate you doing that. And thank you so much, everyone, for listening. And as always, I'll be back again with another episode soon.